Hi John, my name is Tony. I'm going to be your nurse practitioner today. We're going to be doing an assessment of your head and neck as well as your anterior and posterior chest. I have assessed John's vitals. They're all within normal limits. John, how old are you?
16.
Okay, I'm just assessing his general appearance. He looks his age. He's well nourished. He's dressed appropriately and he looks healthy. John, we're going to start with a skin assessment, and what I'm looking at is for any abnormalities, any lesions, any moles, any nodules. I'm also going to assess for cyanosis, jaundice, erythema, and pallor. So I'm going to I'm going to look at I'm going to start by inspection of your skin. And I noticed that there's nothing unusual. I'm also going to palpate your skin, and your skin is warm and dry as well as it is smooth and firm. Okay. Next, we're going to move on to inspection and palpation of your skull. So I'm just going to look at I'm going to assess your skull for any indentations, any bumps, or any lesions or moles. So I'm going to gently palpate your skull. And then I'm just going to look through your hair to see if there's anything that I see. And I don't, so I'm assessing for any moles, any lesions, or any infestations. Next, I'm going to examine your hair and the distribution of your hair, and the distribution is symmetrical. And then I'm going to assess like the texture of your hair, and your hair is smooth and shiny. I'm going to assess cranial nerve number 5, and I'm going to touch your face with something soft in 3 parts, and I'm going to have you close your eyes, and you're going to tell me if you feel it.
Yes, 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 yes.
I'm also going to do that with a different object.
Yes, 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 yes.
Good. Now I'm going to assess cranial nerve number 7. So I'm going to have you frown. I'm going to have you raise your eyebrows. I'm going to have you frown. I'm going to have you smile. I'm going to have you show your teeth up and bottom. Okay, and I'm going to have you puff out your cheeks. So cranial nerve number 7 is intact. I'm going to palpate your temporal arteries for elasticity and tenderness. Any tenderness noted?
No.
Okay. I'm going to palpate your temporal mandibular joint, which is right here. Please move your jaw side to side and open and close it. And any pain or tenderness?
No.
And I'm assessing for any popping, crackling, or grating. Next, as I continue through the exam, I'm also going to assess your skin. Next, I'm going to test your visual acuity, and I'm going to ask you to read this lowest line on the Snellen chart.
D-E-F-P-O-T-E-C.
Please change it to the other eye.
D-E-F-P-O-T-E-C.
Now please read it with both eyes.
D-E-F-P-O-T-E-C.
Good. Next, I'm going to test your near vision. I'm going to ask you to read the lowest line here, and the card is going to be approximately 14 inches.
L-T-F-P-H.
So you do have 20/20 vision, John. So what I'm going to do next is that I'm going to assess your peripheral fields. When I'm going to cover my right eye, you're going to cover your right eye. I'm going to take my hands, and when they move into the peripheral field, you're going to say when you see them, okay?
Yes, 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 yes.
Good. Next, I'm going to do look at extraocular movements. So what I'm going to do is have you follow my finger with your eyes only. Please don't move your head. John was able to track them normally. Next, I'm going to have you look over my shoulder, and I'm going to test for accommodation. So I'm going to come in with my pen light from the side, and your pupils are they are equal, round, and reactive, which is a normal sign. Next, John, I'm going to have you cover one eye, and I'm going to test for peripheral nystagmus and lid lab. So I'm going to ask you to take this, and I'm going to take my pen light, and I'm going to come in from the side. Good. And please cover the other eye. Good. Okay, John. What I'm going to do before we do the examination of the fundus, I'm going to inspect your eyebrows, I'm going to inspect your eyelids, I'm going to inspect your eyelashes, and I'm looking for anything, any swelling or inflammation. And then I'm going to check you. I'm going to inspect your conjunctiva, which is red. I'm sorry, it is pink. So conjunctiva is pink and your sclera is white. Okay. So John, what I'm going to do is I am going to now, I'm going to palpate your lacrimal apparatus, which is here and here. And do you feel any tenderness?
No.
Okay. So John, what I'm going to do is I'm going to now inspect your eye, the back of your eye. I'm going to take my ophthalmoscope and I'm going to look. I'm going to engage the red reflex. And when I do engage the red reflex, I'm going to move closer to you. So I have it engaged, and now I'm going to look, and I'm going to come closer. And John, what I'm looking for is I'm looking at the back of your eye, and I'm assessing your optic disc, the vessels, the retina, and the macula. And I'm going to do the same thing on this side. And I'm going to move in again. And again, I'm assessing the optic disc, the nerves, the macula, and the retina. And you have a completely normal eye exam. Next, we're going to move on to the nose. So I'm going to inspect your nose. So I'm going to inspect your nose. Your nose is symmetrical in your face. It is appropriate for the size of your face. And I'm going to just palpate your nose for any pain or tenderness. None. Do you feel anything?
No.
I'm going to look at your septum, and I'm looking for deviation, and there's none noted. I'm going to ask you to cover one of your nostrils and breathe in and breathe out. Okay, so and that's assessing the patency of your nares. And then I'm going to ask you to close your eyes, and I'm assessing cranial nerve number 1. What do you smell?
Vanilla.
Okay. And then I'm going to palpate your sinuses. These are your maxillary, and these are your frontal. And is there any pain or tenderness?
No.
Okay. Now I'm going to look up your nares, and I'm just going to assess them for color, which they are pink. There's no drainage, swelling, or discharge. And I was able to see the middle and inferior turbinates. Okay. Next, we're going to move on to your ears, and I'm going to inspect your ears. And I'm looking for any nodules, redness, tenderness. So this ear looks good. I'm sorry, and this ear looks good too. And next, I'm going to palpate this. I'm just going to pull them up gently in all different directions. I'm going to press down on the tragus. Tell me if there's any pain.
No.
Pull up and press down on the tragus.
No pain.
Okay. Next, I'm going to look inside your ear, and I'm going to look at the tympanic membrane. And what I'm going to do is pull your ear back, and I'm going to look. Okay, and your tympanic membrane is pearly gray, clear, and translucent in this ear. And I'm going to do the same with this ear. It's pearly gray, translucent, and clear. So your ears are clear. Next, I'm going to perform a whisper test. And the whisper test I'm going to do from behind, and I'm going to push in your tragus, and I'm going to whisper through 2 words.
Ball cat.
And I'm going to do it on this side.
Ball cat.
Next, John, I'm going to do the Weber test, and the Weber test is a test for hearing loss due to bone conduction. Okay, so I'm going to tap the tuning fork on my arm. I'm going to place it on the top of your head, and you're going to tell me when you no longer hear the sound.
It's gone.
Okay. That is a completely normal finding. Next, we're going to do the Rene test, and that I'm going to place the tuning fork on your mastoid bone, and you're going to tell me when you don't hear the test. Then I'm going to move it from the mastoid bone, and I'm going to move it to the outer part of your ear, and you're going to also tell me when you don't hear it.
When am I? When am I? Away. Away.
Thank you. Those are all completely normal findings. Next, we're going to move on to inspection of your neck. And I'm just going to inspect your neck. I'm going to look for any lesions or moles or nodules. I'm also going to inspect your trachea, and your trachea is midline. I'm just going to palpate it really quickly, okay? And then what I'm going to do is I'm going to palpate your thyroid. So you do have some water, so I'm going to palpate it from a posterior approach. And when I tell you to swallow, I'm going to ask you to take a sip of water, and then I'm going to ask you to swallow. Okay, so John, please take a sip of water. Perfect. And there's no nodules noted on your thyroid. I'm going to ask you to do a range of motion on your neck. So I'm going to ask you to look up, look down, look side to side, and then I'm going to ask you to try to touch your ear to each shoulder. Okay. Next, I'm going to palpate your lymph nodes. So this is all I'm going to be doing on your neck. Oh, that's not true. I'm going to palpate here. This is your preauricular and your postauricular and your occipital. And I'm going to come to the front here, and these are your tonsillar, these are your submandibular, and this is your submental. I'm going to go right down your neck, John, and these are your deep cervical. You go all the way down to here, and then these are your superior cervical, and these are your posterior cervical, and then these are your supraclavicular. Okay. What I'm going to do too here is palpate your carotid artery. So I'm going to do that one at a time. I don't want to make you pass out if I do it at the same time. Then I'm going to ask you to breathe in and breathe out, and then hold it. No.
Oh.
And I'm going to auscultate with my bowel. Breathe in, breathe out, hold it. Perfect, no sound is noted, which is a completely normal finding. Next, I'm going to do your mouth and throat. So I'm going to take a tongue depressor, John. I'm going to look in your mouth. I'm just going to gently pull down your lip. And what I'm assessing is your teeth, and they're white, they're straight, there's no debris noted. Please open your mouth, and there's no cavities noted. And while I'm in here, I'm going to just assess, open your mouth more, your buccal mucosa, and it is pink and moist. And I'm going to just have you lift up your tongue, and I'm looking at the underside of his tongue for any lesions, which is completely normal. John, I'm going to ask you to take a little bit of salt because you have a very heavy gag reflex. The salt aids in the gag reflex. I'm going to ask you to stick out your tongue, and I'm going to assess your tonsils, which they are about a +1 back there. I'm sorry. I'm going to have you say ah. Sorry. Okay, and that is engaging cranial nerve number 9 and 10, which is your palate, soft palate moved up and your uvula moved. So, I'm going to assess your soft palate again, which is good, and your pharynx. Can you open up again, John? And your pharynx is fine. Okay, so basically I'm going to also have you stick out your tongue, and that's this cranial nerve number 12 too. And I'm just going to have you, it is midline, I'll have you move it back and forth, okay? Then I ask you to put your tongue back in your mouth. I'm going to have you press on each side. Okay, so that's good, with resistance, good. Okay, so I'm just going to, one more thing I'm going to inspect, just stick out your tongue, and I'm going to look at each side of your tongue, making sure that there is no lesions, again, on your tongue. So, that is a completely normal finding. Your mouth is done. Now we're going to go to your posterior, your back, your posterior. So I'm just going to have you, So what I'm looking for is symmetry right now. The shoulders are symmetrical. I'm going to ask him to give himself a little bit of a hug in the front. And I'm looking for the scapulas to also be symmetrical, which they are. I'm going to just assess him for his breathing, just making sure that the breathing is normal. So John, just please breathe normally. Good. So I'm just, his breathing is normal. There's no use of accessory muscles. So John, what I'm going to do is I'm going to palpate your back. And actually what I'm going to do is I'm assessing for tactile fremitus. So I'm asking you to say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Good. John, I'm going to also auscultate your back. So I'm going to be listening to your lung fields. And you're going to give me one full expiration, right? Good. Go ahead. Breathe. Okay, all lung fields are closed, no adventitious breath sounds. And then finally I'm going to percuss your back. So I'm going to here, here. Okay, so John, if I were to percuss over your bone, it would be flat, but since I'm percussing over your lung fields, there's a resonant sound. Now I'm going to ask you to turn around. I'm sorry, but I'm sorry, I just have to ask you to go back around to I got to palpate your back, I have to. So I'm going to go between 9 and 10 on the back, and I'm going to put my hands, and I'm going to ask John to breathe in, and I want my thumbs to come together, so go ahead, and then come out. So his chest expansion is good, and then what I'm going to do is I'm going to assess for the costovertebral angle, and I'm going to go to the rib number 12, and then I'm going to go over to the spine, and in here I'm going to put my hands, I'm just going to hit it, John, and I'm assessing for tenderness, okay? Any tenderness?
No.
Again, rib number 12 to the spine. Any tenderness?
No.
And that would, if there was tenderness in this area, there would be an indication that you have a kidney infection or something wrong with your kidney. So now we're going to inspect your anterior chest, and really what I'm looking for is the rise and fall of your chest. So just breathe normally for me. Good. So he's breathing normally. His chest is rising and falling appropriately. I'm going to just assess for chest expansion again. So John, deep breathe. In, out. Good. And then I'm going to assess for tactile fremitus again. So 99.
99, 99, 99, 99, 99, 99.
Good. And then I'm going to auscultate your anterior chest, John. So deep breath. Wait, deep breath. Okay, deep breath. You can breathe. Okay, John, and I think that concludes our health assessment. Thank you.
Thank you.